This is the Teche Action Clinic. We're located in Franklin, Louisiana, 1115 Weber Street. We've been around since 1974 and have the distinction as being the oldest community health center in the state of Louisiana. I've been blessed to be the CEO now for over 10 years, and I've been here for a total of 30 years. We offer complete care for the whole lifestyle, beginning with OB/GYN service, pediatric service, family practice, family medicine. I'm an internist. We also have full laboratory services, an on-site pharmacy, mental health services, dental services, Medicaid enrollment, WIC, nutritional services, and general social work and referrals. We are what's called an FQHC, and that stands for a Federally Qualified Health Center. So part of our funding comes from the federal government. It's your tax dollars at work for you. We use that money to help subsidize the uninsured that utilize our services. No one can be turned away regardless of ability to pay. So we use a sliding fee scale that's developed by the federal poverty guidelines. And we're directed by a board of directors. 51% have to be consumers. So the patients are actually involved in the care and setting policy and hours of operation. We try to make ourselves a barrier-free facility and really give the patients access. So in that vein, we're open 6 days a week, Monday through Saturday, from 7:30 a.m. to 7:30 p.m. We specialize in primary and preventive care. So we keep people out of the emergency room, and we do things to keep people healthy and maintain their good health. That's the whole basis. The best prevention is early detection. So we get people to be a part of their care and to engage in self-empowerment. We like to consider ourselves, and we are certified as a patient-centered medical home. So we want them to come in and be a part of this medical home, and we can care for all their family needs.
How are you doing today?
I've been experiencing problems.
Several of our patients have multiple chronic diseases such as hypertension, diabetes, obesity. So we offer them an array of services, preventive both in primary care and preventive. The majority of our patients here, like most of South Louisiana, have type 2 diabetes. Some of them are insulin dependent, others can be controlled with oral medications, and of course diet and exercise. It's been a long time problem, especially in South Louisiana, but we're seeing it more and more, especially type 2 diabetes in the adolescent population. Now we're seeing that more. Our patients, I'm not sure what they would do. You know, I know that there are other centers out there, but we see all patients regardless of their ability to pay or their financial status or class. We provide the medications that are needed, the education that's needing one-on-one and group sessions, and lab services as well.
Hello, Miss Bianca. How are you doing?
Well, Dr. God, I'm not feeling good today.
I'm a family medicine doctor, and predominantly we take care of diabetes, high blood pressure, high cholesterol, and the basic primary care needs are provided to the community. Predominantly, our patient they have diabetes and high blood pressure and high cholesterol. We take care of these patients, and we control the diabetes by medications, and we control their cholesterol by lifestyle modifications, and sometimes by medications. And we have a very good outcome from the medicines we use and the lifestyle modification along with the medications.
Hi, how are you today?
Oh, I'm great, I guess. I'm just in here to have my blood pressure checked.
As a nurse practitioner, I see patients from childhood through adults. I do pap smears, family planning. We order medications and labs. We try to see the patients that are not quite as difficult that physicians would need to see. We're the in-between. We do well visits. We can do sick patients. We do cough and colds, immunizations. We also do school physicals, job employment physicals, and pretty much anything that comes in, unless it's a little bit too difficult. I can manage diabetes. I also manage hypertension. We usually do mild pain or acute pain, not chronic. And that's a typical day for me. Patients who generally come to see me are mid-30s, 40s, 50s, diabetics, hypertensives. They come in for their chronic management. They come in usually about every 3 months. We get patients from throughout the community. We get patients from the surrounding communities too, from different areas from word of mouth, actually. The value of the clinic is that we serve everybody. We don't turn anybody away. We serve patients who don't have insurance. We serve patients who do have insurance. We go above and beyond to make sure we take care of anybody and everybody. I think without this clinic, a lot of patients would suffer. They have to go all the way to Lafayette, or they'd have to go all the way to Houma, which is very cumbersome if they don't have transportation. We're here until 7:30. We're here from 7:30 in the morning until 7:30 at night to provide services to try and keep people out of the emergency room. So anything that can be handled in a clinic, we can do. And actually, because we're on a sliding scale fee, that helps the community.
We're standing in our first operatory. We have 6 operatories. A dental unit is called an operatory. That's where the patients receive the work. And we've been in this particular building since 1994, right after Hurricane Andrew. This building was established. And we've been here, and I've been here with these 25 years, and I saw more pathology in my first 6 months here than I did my 11 years of private practice before coming here. So our major concern has been to simply teach preventive dentistry, do restorative dentistry, which is fillings, etc., extractions, fluoride applications, etc. We're focused primarily on trying to teach the children to take better care of their teeth, to prevent what I have seen so much of, a lot of damaged teeth, excessive caries. It was so excessive when I came here in 1987, I was just completely bombarded by excessive decay. That's been changed quite a bit since that time, and parents are working more with us to try to get the children to do more preventive care, which is proper flossing and brushing, application of fluorides, and that's made a big difference. Proper dental health is important because without proper dentition, you can't really masticate or chew your food properly, and thus you're already behind the 8 ball in terms of having proper digestion and proper elimination of foods. If you can't really chew it well, you swallow whole boluses, and you really can't get the nutrients out as well, as and that's a problem. So dental care is extremely important from the standpoint of preparing everything to enter your system. If it wasn't for this clinic, there'd be a lot of people who wouldn't really get the care, because a lot of the indigent know that we're here, we've been here, and although some can go elsewhere, many can't. And those who can't definitely come here. And we treat them as well as we can. Many come also because they're treated well, but they also come because they need to be here.
The patients, when they come in, usually range between 3 years of age to 80 years of age. And I see all ages of patients. Services range from dentures to fillings, extractions, any emergency situations, and any other types of general dental problems that the patient may have.
Hi. As a Tulane third-year medical student, I'm here in Franklin, Louisiana, following Dr. Gautam. I'm doing my family medicine rotation here for 6 weeks, and right now I'm learning the way family medicine works in general. So how to treat long-term diseases, how to take care of patients, how understanding a disease is one part of their entire lives, that one person's made out of a lot of different parts, and so we have to treat the patient as a whole, not as a disease. And it's really interesting to learn from Dr. Gautam because he has a lot of experience where he's from, and he really worked hard to understand the patient, worked hard to really figure out what's going on with the patient in general. My experience in the clinic so far has been great. It's been so much fun here. Pretty much every day what I do is he assigns me patients, and I go in, I do the entire thing. I have so much autonomy here, and of course he's always watching, always making sure I report to Dr. Gautam. He teaches me every single step of the way, and I'm able to see the patient and see everything, do everything. It's pretty exciting.
I enjoy working in this clinic. and because the patient population need our services, and we are able to provide a very good care at a very low cost to the patient.
I think the patients get really great care here, and the nurses and the doctors all really care, and I know like sometimes it's hard, and a lot of these patients don't have health care, don't have insurance, and I think it's really great. Everyone's working hard to make sure that they do.
I do enjoy working at Teche. I've been in the Teche system for 11 years before I went to dental school, and Teche is like a family, and I get to serve the community that I was raised in, and that's very special to me.
I love my job. I love taking care of people. I've been a nurse since 1992, and I love the community environment that's here. I actually drive in from Houma to work in the Franklin Clinic because it's down-home community people. I wouldn't work anywhere else but Teche.
If it wasn't for this clinic, I'm not sure what our patients would do. I know that they would have to travel a minimum of, from this area, a minimum of 60 miles to receive any type of services. I love working here. I've been here for 12 years now, and it's because we treat the whole patient, and we treat the patient, their family. It's a generational sort of care that we provide. The mother may come in with children that we can identify early with some type of problem and prevent any exacerbation of that, or a child may bring in their parent, vice versa. So I love the care we provide.
It's sort of like that old TV program Cheers, where everyone knows your name and they're always glad you came. We want to be your patient-centered medical home, and we are like family, and you're part of our family.
If people have questions, like more information about the clinic, what should they do?
You can call us at 337-828-2550, and we'll be happy to answer any questions or any information that you would need.